Alright, what are the odds that this will work? This is Jim. I live in Texas. The first thing I'm going to do on my Mighty FJR is raise the windshield. Isn't that cool? I'm going to try to adjust my glasses since they fogged over because I'm talking. Okay, well, this is my first vlog and all. It's 55 degrees, so we're out of the polar bear weather that we've been having. We have mini ice age here in Austin, just like some other folks have, but it seems to be over at least for tonight. So I've got a little short errand to run. I thought I'd make another attempt, probably feel it a vlog. This camera range, but it's just not going to work in the long. There's just it's just too much. It worked, I think, in the airplane, but not here. I've already thought of an aviation vlog I want to do. A little more about that later. Okay, let me turn left. Okay. Today, I want to talk about healthcare. Both Sun Gully and, forgive me if I have some pronunciation up there, Utah, and our own Macquarie 7, I'm sorry if I'm messing that up. Macquarie 7. So it's maybe a cop over there. I better stop. I better do it.
Okay, well, it's obvious yet another vlog with horrible audio quality, and rather than subject you to this until I solve the audio problem, if I ever do, I'll just narrate the rest of this video. I want to talk real briefly about healthcare. A couple other vloggers have addressed it, so I will too. Let me say that here in the United States, 75 to 85% of the people have really good insurance. They get it from their jobs, generally speaking, or they can afford to buy it in the private sector just directly from the insurance company. Those people are fine, and if they were forced into a national healthcare type system such as they have in the UK, there would be a revolt. There would be a revolution in this country. You can already see a little bit of that with the AFL-CIO freaking out over Obama's plan to tax Cadillac healthcare because they've got some of the best. The UAW surviving workers have the best healthcare probably in the world. We do have a problem in this country, and I wish President Bush had addressed it. Really poor people can get government health care through the Medicaid and other assistance programs that are available for low-income people. Middle-income people, most of them can get it through their employers. Upper-income people can just afford to buy insurance on the private market or even just pay out of pocket for medical care. There's a group there that work and make a little bit too much money for government assistance, but they either work at a place that doesn't have insurance, or they're students, or they are in some way, perhaps they're starting their own business and can't afford insurance yet, even though they're creating jobs and really helping the economy by doing that. They're economic heroes for starting their own company, but they can't afford insurance. A lot of companies never start because the guy or lady who could start it is afraid to give up her health insurance because maybe they've got a family and they can't afford to take their family off of the company insurance. They can't afford to pay the premiums out of pocket. So we need health care for people who work and contribute to the society and are here legally, citizens and legal U.S. residents. We need a system for them so they can afford to buy insurance in the private sector. And I wouldn't mind a bit if it's subsidized. It should be subsidized through some kind of voucher so that the citizen buys the insurance, not the government doesn't pick it for him. The easy thing to do that could be done with a stroke of the pen is to make the insurance pools much bigger. Let insurance companies compete across state lines, which they can't do now. Let private associations, such as, say, the National Rifle Association or the NRA, the American Motorcycle Association, people like that, let them sell insurance. And basically do everything we can to make insurance pools very large. The larger the pool, the lower the cost. We've got to do something for pre-existing conditions. I don't think somebody should be able to just wait until they're sick and then walk into the insurance company and say, give me insurance, and now I'm checking into the hospital. But maybe you should have a short waiting period, certainly a year at the most, where after that your pre-existing condition is covered. And again, if pools are made very large, then I think that's affordable. Also, the government shouldn't load up the requirements for all sorts of extra things like massages and elaborate drug and alcohol treatment programs and stuff like that, so that the young people, who are many of the ones who can't get insurance, can get basic insurance, so if they crash their motorcycle, they'll be taken care of. We need a capitalist-based, free market-based system with some subsidies for low-income people, so everyone who works and contributes to society, or who can do that. And obviously, we're not talking about people now who are just disabled or for one reason or another can't work, can get insurance now. So we're talking about making sure every working person in every family can get reasonably decent medical insurance, at least equivalent to, say, the VA, what people in the VA system get. That seems to me very attainable and very reasonable. The Obama bill, 2,000 pages. Obama promised 8 times to make his decision process and design of this bill extremely open, and even televised deliberations on C-SPAN. He promised that 8 times on video in the campaign. You can look it up on YouTube. It's all being done behind closed doors, Democrats only, in smoke-filled rooms. And not even all Democrats, just the inner core of the Democrats. Most of the Congress and 100% of the people who aren't extremely well connected in Washington, really, we're all just standing on the outside, just waiting for the smoke to come out of the chimney and them to come out and tell us the miracle they're going to do for us. This is called the politician's fallacy in terms of logic. The politician's logical fallacy is this. There's a problem, something must be done. This is something, so let's do this. Well, let's not do this. I'm hoping and praying that Mr. Brown wins in Massachusetts and the Democrats don't succeed in their nefarious and evil plan to keep him out of Congress, even if he does win, at least long enough to cram this bill through with a totally bipartisan vote and stuff it down the throats of the American people who clearly don't want it. If the bill is defeated, maybe we can do what Obama promised, which wouldn't have been so bad, to bring everyone who's a stakeholder in this, even Republicans, into the negotiation and come up with something that is more capitalistic. I guarantee you the President Obama plan has death panels, and they won't call them that, but let me give you an example. When I lived in the UK, I'm listening to Radio 4, which was at that time a talk radio station primarily. They were interviewing doctors about kidney transplants. And the doctor mentioned that you didn't get a kidney transplant if you're over 55 in the national health system in the UK. And the reporter said, well, how do people react when you tell them that? She says, oh, we don't tell them that. We just tell them they're incurable. So that's a death panel, and that's one of the evil things that are in this horrible Obama bill. So anyway, it's my opinion that it would be quite possible to have affordable health insurance for everybody, subsidize it with basically with vouchers or tax credits, so that people who are working and contributing can afford insurance, so that people who have pre-existing conditions can get insurance. And people, as long as you're willing to exercise at least a modicum of responsibility, you ought to be able to get insurance in the United States of America. I don't think that's an unattainable goal at all. I do think the way we're doing it now is the wrong way. So anyway, this is Jim, and that's really my point about the health care system. And my TV just turned on, and I just really like my FJR. Stop, TV, stop. What on earth? Anyway, well, I've finished fighting with my TV. I'm about to pull into my wife's tax office here in Cedar Park, Texas. It's a good place to get your taxes done if you want. And I'll try to edit this so she makes a little cameo appearance. Got a few seconds left. Let me just say the FJR is awesome. I'll make a dedicated video on the FJR later. But it's very cool to experience time dilation, blue and red shifting when you open the throttle on this bike. It's that fast.